The start of COVID-19 in the U.S., doctors are still unpacking its impact.
As part of Lee Health's first ever research day, a team of doctors presented their findings, including a study that they did on the effects of COVID on pregnant women. Wing News Health and Medical reporter Amy Osher has this exclusive story.
It's like a science fair for doctors, this one featuring the accomplishments of Lee Health physicians.
There's always been this wanting of highlighting everything that's being done in our institution for almost 30 years.
The topic list is long, dipping into all aspects of care, all local, found within the health system setting. In this first ever event, there are 38 presentations. Some of them are scientific studies, others are published research. Some doctors were called on to talk about their research. Doctors Cherry Morris and William Liu looked at the impact of COVID-19 on pregnant women, specifically the Delta strain.
We were seeing more babies that were born smaller, and when Dr. Morris came to me and she said, "Are you seeing more problems in the NICU? Because we're seeing a lot more morbidity, sicker moms."
Their research looked at 173 pregnant women from January 2020 to November 2021 who all had Delta COVID. Those women needed more medical help. They had higher rates of C-sections, worsening maternal conditions, and more preterm births. Babies tested normally after birth. Studies also found Delta pregnancies resulted in more stillborns, showing the virus had an impact.
There probably wasn't a direct effect of COVID on the baby, but there was something going on with mom, and we believe that there was a placental insufficiency played a role in that.
Their published studies are now part of the Knowledge Collective, putting local research on a worldwide stage. Amy Osher, Wink News.
Amy, thanks. During the Delta surge, several studies across the country found a higher rate of negative impacts, especially stillbirths. This was likely because the Delta variant made people sicker.